Does levodopa response affect DBS for Parkinson's? Imagine trying to fix a complex machine. You want to know which parts are working well and which need help. In Parkinson's disease, doctors look at how well a person responds to levodopa to decide if deep brain stimulation might be helpful. Levodopa is the main medication used to manage motor symptoms like tremors, stiffness, and slowness. If symptoms improve significantly after taking levodopa, it suggests that dopamine deficiency is a major cause of the motor problems. This response is important because it helps determine if a person is a good candidate for deep brain stimulation, or DBS. During a typical evaluation, doctors perform a levodopa challenge test. They measure symptoms before and after giving a dose of levodopa. If symptoms improve by at least 30%, this indicates a strong response. Such a response suggests that the motor issues are mainly due to dopamine loss, which DBS can target effectively. On the other hand, if symptoms do not improve much, especially issues like gait, balance, or speech, DBS might not provide as much benefit for those problems. Research shows that the level of levodopa response before surgery can predict how well someone might do after DBS. Patients with a good response often see better improvements in tremor, rigidity, and slowness of movement. For example, if tremors respond well to levodopa, deep brain stimulation in the subthalamic nucleus or globus pallidus internus can significantly reduce those tremors. Conversely, symptoms that do not respond to levodopa, such as certain balance or speech issues, are less likely to improve with DBS. After surgery, many patients are able to lower their levodopa doses. This can reduce side effects like involuntary movements called dyskinesias. DBS can also help extend the duration of symptom relief from medication and lessen the off periods when symptoms worsen as medication wears off. However, the relationship between levodopa and DBS is complex. Over time, the brain's response to levodopa may change, and some patients might find that they need less medication overall. Still, most people continue to take levodopa after DBS because it helps control symptoms that the stimulation alone might not fully address. For those considering DBS, the levodopa response test is a key step. It helps doctors decide if surgery is likely to help and which symptoms might improve. It's important to remember that DBS is not a cure for Parkinson's disease. It mainly helps with motor symptoms that respond to dopamine. Non-motor symptoms like cognitive changes or mood issues may not improve with DBS. Every person's experience with Parkinson's is different. While a strong levodopa response is a good sign for DBS success, individual outcomes can vary. The decision to proceed with DBS should always involve a team of specialists who consider all aspects of a person's health and symptoms. It's also essential to keep in mind that DBS is one part of a comprehensive treatment plan, which may include medication adjustments and other therapies. In summary, how well someone responds to levodopa is a crucial factor in determining whether DBS might be beneficial. A good response indicates that the motor symptoms are dopamine responsive, which means DBS has a higher chance of improving those symptoms. It also helps predict how much medication can be reduced after surgery. But it's important to remember that DBS does not help all symptoms and should be considered as part of a personalized treatment approach. Always consult with your healthcare team to understand the best options for your specific situation.